Hi, my name is Waleed Javaid. I'm an infectious disease physician and infection control director at Mount Sinai Downtown and Mount Sinai Brooklyn. I work as hospital epidemiologist for both these places. So I think there are four critical elements that we all need to consider all the time. First one being wearing a mask all the time, 100% of times, for all social interactions. Whenever we are out and about, we should be wearing a mask. The mask can be something like this, or it could be a cloth mask, or it could be anything that that can protect our nose and mouth, and we should cover our nose and mouth at any time we are in presence of public around us. That's one thing. Second is hand hygiene, again being critical. Hand hygiene is extremely important for all of us to kind of adhere to 100% of times. We should wash our hands at different intervals throughout the day. The way I think about hand hygiene is that if you're walking, you're entering a place, entering the gym, you should wash your hands. If you're exiting the gym, you should wash your hands. Wash your hands. You could use alcohol-based sanitizer, or you could use soap and water. You should also consider every act between every exercise in terms of gym. Between every exercise, you should consider performing hand hygiene before and after. And it's an important element that we incorporate hand hygiene throughout our daily lives. Third thing, equally important, is social distance. We should continue to maintain social distancing as much as possible. We should make sure that we're keeping 6 feet away from everyone all the time. There will be exceptions to this rule when we might have to get near someone, walking near somebody, and that's fine. If it's limited, it's very limited interactions are fine. But for all practical purposes, if you're having more conversations with someone, if you're having any um, if you're doing exercise, if you're working together with a group, best option really is to continue wearing your mask during those interactions and make sure that you're at least 6 feet away from other people. And before and after any such interaction, you should always perform hand hygiene. Lastly, I think we should be aware that there is pandemic. So if anybody is ill or obviously ill, one, they should not be going to a gym or any public setting. And if you see somebody who's obviously ill, you should try to either encourage them to go get themselves checked, or if that is not possible, try to stay as much further away from the person who's ill or obviously ill as possible. Yes, they are. And as I would suggest to everyone, is that we need to hold each other accountable for our actions. And during this pandemic, we need to make sure that we all are following certain recommendations. As we talked about the social distancing and hand hygiene, New York State has come out with certain recommendations. CDC has recommendations as well for businesses, but New York State has come out with recommendations for gyms specifically as to what they should do, that include all what we have discussed about already, including social distancing, masking requirements, also making sure the hand hygiene is available, limiting people who need to be in a gym at the same time, and making sure people are not entering the gym who are obviously ill. I think a conversation with the gym administration is going to be important to make sure that we understand what are they doing to address these things. Are they moving the machines, or separating out the machines in a way that the social distancing of 6 feet or more can be maintained? Are they making sure, or they're suspending some machine use? Are they making sure there's enough hand sanitizers or hand washing stations available for people to perform adequate hand hygiene? I think things like that are going to be very, very important. Other questions to ask them is, hey, are you scheduling people? How are you scheduling people? How many people are entering in the gym at the same time? How are you managing people coming in? Are you making sure they're not ill? How are you making sure of that? So things like that would be important questions to ask. Most of the gyms will probably have this information on their websites. So looking at the information, what is available in the FAQs, things like that will be important moving forward. So depending on the activities that a person is performing, certain might be actually higher risk than the others. Anything that requires you to be close to another person, for example, bench presses, stuff like that, that might require another person be near you and all, might increase or enhance your risk. I think partnering up with people is going to be important. Maybe even having small group of individuals that work together might be important, but you need to make sure everybody that you work with or work closely with are also being extremely careful with their activities. Nonetheless, basically anytime you interact with somebody, if somebody's helping you with any interaction, it always should be with a mask on. You should be performing hand hygiene before and after, and the other person should also be doing that. But any activity that would involve another person with you within your 6 feet of distance, your 6 feet of safety, would be higher risk. Any activity that would require you to take your mask off should be avoided. So, for example, if you're running and you cannot really wear your mask in a gym while you're running on the treadmill, I would try to avoid it if I cannot wear a mask during that activity. That's sometimes easier said than done, but I think we'll need to adopt at least for next 6 to 8 months while we work on a treatment or a cure of this illness. There is no clear evidence that it would spread through sweat, but more importantly, um, it would spread through contact. So what does that mean? Um, it means really if I have COVID, I might actually have COVID in around my nose. There might be some droplets or particles there. If I touch my nose, and there are studies that show that that anyone would touch their face about 5 times an hour. If I'm doing that every hour, I might be contaminating my hands. And if I'm contaminating my hands, anything I touch might get contaminated. Now, this is on the higher risk, like if I'm very symptomatic and all that, that the spread would be higher and more likely. That I'll spread it more effectively. But touching might increase the risk of transmission. And I think a point about sweat. I'm not. Uh, I wouldn't worry about sweat as much as just making sure the machine you're gonna use, that you wipe it down or somebody's wiping it down. The handles or handbars, there is ability to wipe that with some disinfectant that might be available. Those things will be important going forward. Uh, I'm I'm not sure if I'll be able to put a number or a percentage to it, and I think it will be very, very hard to determine the risk. But any activity that increases our social interaction is risky. Going to grocery store is risky. Going out on the street with people around you is risky, probably less so than going in a closed space, but still anything that increases our social interaction is risky. Going to a gym where people might be breathing heavily, where there might be close contact with others, is is risky as well. One thing the New York State has recommended is to have enhanced filters in the gyms. And I think if they are able to do that, it might decrease the risk. But anything that causes us to interact with others is going to increase our risk. I think following certain specific guidance, certain specific things is going to be important. So as I said earlier, the components that we need to be very much paying attention to is social distancing, is wearing a mask all the time, washing our hands extensively, staying away from people who might be obviously ill, and possibly in the case of gym, making sure the disinfection of the machinery is done properly, And if I'm going to use some machine, I'm going to use a handlebar or anything like that, that there's ability to wipe it down before I touch it. Things like that might enhance our ability to stay away from this illness during these activities.